Morgan from the University of Manchester, and welcome to the final talk that I'm doing on this important topic of contact lens discomfort. And in this presentation I'm going to be talking about how discomfort can be managed and ultimately how dropouts from contact lenses can be reduced. And we were talking about this in two different segments. Later on I'll be talking about some of the clinical management of this condition, but first let's talk about some operational considerations. And I'm going to be talking about the Dunning-Kruger effect first of all. This is how overall we as humans and as clinicians can overestimate our ability in certain areas. So I think contact lens discomfort is an underestimated issue. I think it's more important than we usually give it credit for. But perhaps as individuals we can overestimate, we're a bit overconfident about how we are good at dealing with this particular topic. This is a piece of work that was done with some senior pharmacy students. I couldn't find similar work for eye care practitioners, so we'll need to rely on data from our colleagues in pharmacy. And when people were asked about their clinical skills, these are the scores that they gave themselves. They were divided into sort of the best clinicians to the poorest clinicians, but here's how they scored themselves. But when third parties, when their assessors were asked to score each of these students, well, you can see on all, with the exception of the very top group, on overall, most people tend to exaggerate their performance for clinical skills. And similarly for communication, and dealing with contact lens discomfort is perhaps as much about communication as it is about clinical skills. Well, similar sorts of results. Everybody thinks they're about the same as everybody else in terms of their communication skills, but when we do that more objectively, we find that many of us tend to overscore or overestimate how good we are at our communication skills. So I think it's perhaps just time to take stock of how we deal with contact lens discomfort and give it the importance that I think it is due in practice. So remember, what we're dealing with here is a significant issue. In the work of Sully, they found that 26% of new contact lens wearers drop out in the first year of use, but this was very, very much front-loaded. Half of those who eventually go on to discontinue do so in the first 2 months. And so we have a large number of people who have been called the silent sufferers. And we really need to understand these people. It's astonishing to find out that when this has been looked at very carefully, a large number of people who go away and in the early weeks of their contact lens use have some contact lens discomfort, that they find this extremely frustrating on average. They try sort of compensating behaviours and maybe don't wear their lenses for as long or try other things. And we would hope that these people would return back to us and seek our advice. But a clear majority, 73% according to Vase, of people in this position do not come and ask their eye care practitioner. They'll look it up on the internet or they'll ask their mates, but they do not come and consult our advice. So this was something astonishing to me. People who we fit with contact lenses, they go away, they're not very happy, they're a bit grumbly, find them a bit uncomfortable, they're quite upset, but they don't come and seek our advice. And the likelihood is they're just going to fade away. They're just going to disappear from the marketplace. These are our silent sufferers, and we need to think about this group very carefully. So one way around this that I know is implemented by some colleagues is to implement a contact lens buddy system. This is where we designate a member of staff, perhaps a member of support staff, an optical assistant, or somebody like that, depending on how your practice is configured, and that buddy is assigned to a new contact lens wearer. So it's the buddy, that member of staff, who does that early important training of application and removal with the new contact lens wearer, but also they keep in close contact with this new patient over the first few weeks. Remember, those first few weeks are particularly important. That's when a lot of people discontinue and they're not going to come back, many of them. They're just going to fade away and become a silent sufferer. So the first few weeks is important. And this buddy system involves things like the buddy ringing up the new wearer on the first day of contact lens use. Now, it would appear the new wearer might be a bit intimidated to come and contact us about it. So we have to flip this around and have us, the buddy, phone the new contact lens wearer. Maybe on the first day, maybe on a week, and so on as required, just to check. Are you doing okay? Are you finding lens handling okay? Is the comfort what you're expecting? And if the patient is replying no to any of these statements, well, can we give them more advice? Can they come in for some further tuition, or for us to look at their contact lenses? And maybe this person should also be around and available for the first aftercare visit. So this buddying system, anecdotally, has reported to be very successful in those practices that employ it. We've done a very small study to try and look at this, and some early data wasn't entirely conclusive, but did have a signal for improved retention, greater contact lens wearer success when a buddy system was implemented. What can we do more clinically? Well, I do think this is something we need to be addressing at every contact lens aftercare visit, asking our patients about discomfort. We can use the CLDQ8 questionnaire if we want. If they're getting a score of 12 or more, then we need to be doing something about it, or we can ask for a more simple 0 to 10 scale. I think it doesn't really matter how you do it, but I think it needs to be addressed, and not just waiting for our patients to mention this as a problem, but at each aftercare visit, how is your comfort with your contact lenses? Can you give me a score out of 10? And acting accordingly if there's something there that you don't like, or you have any concerns that they might have discomfort, which ultimately can lead to dropping out. Now, in an earlier talk, I described the causes of contact lens discomfort. Which of these, a long list of factors, might be associated with contact lens discomfort, and I summarized it in this Venn diagram. Well, these are all things that potentially we can change. The first then is the environment in which the patient is working. Low humidity, if they're working with VDUs, or if the air conditioning's on, these have been associated with increased levels of discomfort. Now, in reality, these might be hard to change without somebody seeking a new sort of job, perhaps, but maybe they are in a position where they can modify their use of a VDU, or modify their atmosphere in terms of its humidity or their air conditioning, and they, in doing so, can improve potentially their contact lens discomfort. What about patient factors? Again, smoking, use of oral contraceptives, their immune status of the ocular surface, and potential use for omega-3 supplements. Again, maybe some modifications of this can be made, but they're all rather difficult. They're all rather major lifestyle choices that are being made, and may be difficult to change. So perhaps most of what we're able to do as contact lens practitioners, eye care practitioners, relates to the lens that is being used. Remember that I've described that friction and lubricity of the lens surface is associated with contact lens discomfort. We want a friction which is highly lubricious, or which is associated with a lower coefficient of friction. Now, how can we assess this front surface lubricity or wettability in practice? Well, if we're lucky to perhaps be working in more of a research environment, we might have a device like this, a tear scope, which allows us to look at the lipid layer, the front of the tear film on the front of the contact lens, to see what's happening there. Do we have a stable tear film that's allowing for a well lubricated movement of the eyelid over the front of the lens? Or maybe something like this. Here we have the same patient with a contact lens in, and we can see above the pupil now a lot of coloured fringes coming into play here, as the lipid layer has variable thickness. The pre-lens tear film is thinning, and we have a less well lubricated system. Well, that's fine to do this with a device like a tear scope, but in fact we can do this with a slit lamp in normal practice. You don't need a tear scope, but I think this is something that's helpful to do at contact lens aftercare examination. What we have here is the slit lamp at high magnification, maybe 30 or 40 times. We have kind of narrow and a very short slit beam. But you can see here on the same patient, we're getting the same patterns now when we look into the bright reflection of this slit lamp beam into the slit lamp viewing system itself. So again, you can see these coloured fringes, you can see these little dots perhaps in the reflection which signify a drying surface. So you actually can use a regular slit lamp, you don't need a tear scope, to get a sense of the lubrication at the front of the contact lens. And maybe you're seeing something that dries out very quickly, and again that might be associated with contact lens discomfort, something we need to do something about. The movement and the lens edge is something that's important as well. You can see here on this OCT image on the right hand side how, you know, a comfortable contact lens edge is one that actually interacts with the conjunctival surface and might actually bury itself down a little bit into the conjunctival surface. That is a comfortable situation. It might lead to a little bit of conjunctival staining, but overall I would take a little bit of conjunctival staining for a more comfortable lens. Now this means we need lens movement something like the video on the left hand side of this slide. Now maybe some years ago we'd have thought this movement isn't enough, there isn't quite enough movement, but I think that's probably where we need to be at now. When the patient blinks with a contact lens in, we just want to see maybe 0.2 millimeters of movement, something of that order. I think we just want to detect a little bit of movement so that we know the lens is not adhered to the conjunctival surface, but if we can see a little bit of movement, I think that's okay. That's going to be a comfortable situation. More movement than this, certainly once we get up to 0.5 millimeter or more, that's likely to lead to a noticeable lens and an uncomfortable lens. Deposition has been associated. Well, there is this association of a lens being comfortable when there is non-denatured protein on its lens surface. This, however, is probably too difficult to assess in contact lens practice. So all of these things seem to be important, but we don't really have the option with modern soft lenses to order a lens that's the same in all respects apart from this one feature. We can't really order the same lens brand, but please can you supply it to me with a different lens edge, for example, or the same characteristics but that moves less. But what we can do perhaps is look for a different brand, change the brand, be proactive, do something if there is a sense of discomfort in your contact lens wearer, and you can perhaps identify one of these characteristics as not being perfect, then order a different lens brand. And the same applies also to lens replacement. On the whole, on average, if lenses are replaced more frequently, that there is evidence that this leads to a more comfortable situation. Remember why I'm doing these talks. It's about contact lens discomfort, because contact lens discomfort is the number one reason for discontinuation. It's a tragedy that we go to all this effort to fit our patients, show them how to use the lenses, maybe how to use their solutions and look after them so well, for such a high proportion of people to leave lens wear, to drop out, to discontinue. And yet we know more and more about this, and we can do something about it. Remember, this has a dramatic impact on the number of contact lens wearers. So we want to look after our patients as best we can, individuals, but also this more globally has a big impact on the success of a contact lens practice or the contact lens industry more generally. At the current rate of inflow and discontinuation, then over a 20-year period, we might see the number of contact lens wearers for practice increase maybe fourfold. But this is very dependent on the discontinuation number. Small improvements in the numbers of discontinuation, small reductions, actually lead to a very different scenario as we project out for the next 10 or 20 years. So we can make lenses much more successful. In conclusion, we can change this, we can make this better. It's within our capability, absolutely. About a quarter of people will drop out of contact lens use in their first year. That's a tragedy, but this can be reduced. Half of that group, half of the people who drop out, do so in the first 2 months, and many of whom won't come and tell us anything about this. They're the silent sufferers. So think about a buddy system, how that can work. Remember that discomfort is the big cause of dropouts, and I think it needs to be addressed at every contact lens aftercare. I think we need to ask about discomfort from our patients, get them to score, give us a score for comfort, 1 to 10, 0 to 10, give them a questionnaire, whatever it might be. Think about the issues that are associated with contact lens discomfort, and in contact lens term, it's the lubrication of the surface, movement and the lens edge, and also replacement frequency in particular. If we can get this right, then we would expect to see fewer dropouts and more successful and happier patients. So in summary, I think we need to be asking about this, discussing it with our patients, and if we can see improvements that can be made, then managing the situation, being proactive, doing something about it, reducing the likelihood of our patients to discontinue. I think contact lens discomfort doesn't receive the importance that it should in our practices. So hopefully over these few talks I've given you some ideas, hopefully inspired you to think a little bit more about contact lens discomfort, how we can manage it and how we can make our patients more successful.